All right, we would love to welcome everyone tonight to our live webinar series that will also be recorded and shared on our website and YouTube for you to watch later. Thank you for everyone that starts tuning in now. We are so excited to have with us part of the team from Nationwide Children's Hospital. We've been working with them over several months to provide programs and webinars and talks, and they have been just great and really well received. So we are bringing one that has been highly requested back, being the best patient parent. So we are excited to share that with everyone. Before we get rolling, I always like to read a small disclaimer. We want everyone out there to understand that this is a session for informational and educational purposes. It will be led by licensed health professionals, but is not intended to diagnose or treat any illness or condition. No one on the call can offer specific or individualized medical advice, but they will share from their own experience. For medical advice and professional help, we suggest you contact your own medical provider or team. And of course, the views, thoughts, and opinions expressed in this panel belong solely to the speakers and not necessarily to the Children's Craniofacial Association or the speaker's employers, organizations, committees, or other groups of individuals. So with that out of the way, I would like to again officially welcome you all. I'm 𝐁𝐞𝐢𝐬𝐵, the Executive Director of Children's Craniofacial Association. And I am, as I said, just so pleased that we are able to offer this virtual content. We started it and it has been doing really well for our family. So if you enjoy it, please let us know what topics you want to hear in the future. So without further ado, I will now introduce our two speakers tonight. Who will discuss how to best communicate with your doctors, navigate the team experience, make your concerns known, prepare your child, manage the anxiety you feel with coordinating care, help you encourage medical compliance, give you some advice on how to choose a medical team, and ways to empower your child to be part of the treatment planning process and when to have those key conversations. And the two people leading us into this discussion are Dr. Gregory D. Pearson, who is a pediatric plastic surgeon and associate professor specializing in craniofacial surgery at Nationwide Children's Hospital. He loves caring for patients with craniosynostosis and cleft lip and palate. And Dr. Ibrahim Kanza is a pediatric plastic surgeon and craniofacial surgeon at Nationwide Children's Hospital. His passions include craniosynostosis, mid-face surgery, and orthognathic surgery. So those are all topics that are extremely pertinent to our community. So thank you both for being here.
Thank you for inviting us.
Absolutely. Absolutely. Well, I'm just going to turn it right on over. You are the experts and you are who we're here today. So as the questions come in, if there's a good time, I'll interrupt, but otherwise we'll take most of those at the end.
Okay, great. So thank you for inviting us. We're thrilled to be here. We gave part of this talk previously and it was well received. So we were asked to give it again. Dr. Ani Drapeau, who is our neurosurgeon, unfortunately is on call tonight and got called in for an emergency. She apologizes that she can't make it tonight, but she has influence in this talk and has put it up with us, and she apologizes. So thank you very much for joining us. Any talk that we give, we like to say we have no financial disclosures that are relevant to this talk. So Dr. Kanza?
So this talk is about how to be the best patient parent that you can be. Now to kind of summarize the various aspects of this, we came up with an acronym, CARE, C-A-R-E, where C stands for communication, and we'll get into more detail about these various parts of the acronym: communication between you and your child, communication between you and your other children, and communication with the physician team. A is anxiety management, managing anxiety in your child, in yourself, and in the siblings. Resources, how to best find and utilize resources to help you and your child achieve the best possible outcome. And finally, and probably most importantly, is empowerment, how to empower your child to take ownership of their health. Dr. Pearson?
So when we think about communication, the first C in the CARES moniker we've put up is, first of all, with your doctor, and whether it's you or your child or other family members, just be open and honest with us. I mean, sometimes it's not always easy, but we're realistic. We realize we're not perfect. We realize that we don't always understand the issues that are at hand. We realize that that we want to help you, and you realize that as well. But you have to also understand that we can take honesty, and not being honest with us about good things or frustrations or what you're expecting, just it puts a little wall, not intentionally, but it puts a little wall. And so you have to realize that, we've probably heard worse, and we'll probably hear, that other things like that as well. And so just starting that open, honest dialogue is really key. Whether it be medical or psychosocial or anything, just having that. I find that if you come in with a list of questions, I think it's really beneficial. I think, and I'll let Dr. 𝐁𝐽𝐬 comment on some of these as well, because frequently an appointment can feel rushed. The doctor, we have a lot of stressors. We want to spend as much time with each patient, but we also want to make sure that we're focused on the issues at hand. And I think sometimes in the hustle and bustle, if you have a list of questions and that's what you want to address for that one, of that appointment, I think it really helps. It leads to no buyer's remorse. And also realize you can always have a second appointment. And this is one area where I think telehealth has actually helped healthcare a lot, because if you live a little ways away from your doctor and, in traveling just for questions, there's sometimes we have to lay our hands on a patient or see them and examine them, but there's sometimes we can just do things over telehealth. And I think that utilizing that and implementing that in the care of your child is really important. I think, Dr. 𝐁𝐽𝐬, do you have any other comments on those?
No, I do really want to emphasize, write down the questions, because the clinic day or OR day is going to be stressful for you. You're going to forget some important things. So bring a written list of questions and then just check them off as they get answered.
I think it's critical to be honest with your child. I think if not, it sets them up to be suspicious of what's going to happen. It sets them up to be with more anxiety, and we'll talk a little bit about that. And also encourage our child to be honest with the doctor about what their happiness and what their concerns are. But it's never comfortable as a provider when a family says, don't mention the surgery word. Or don't do this. It makes it challenging. And if you know your child's going to get a shot, it's okay to tell them that. It's better that, in my opinion, for most kids to know that, because it lets, I think if we can't establish trust, it causes problems. And so, kids don't always want to hear that, but like one of the first things I always say, I very rarely give shots, thank God, in the clinic, I say, we're not going to do any shots today, or something like that. But just having, again, being open with your child, and you have to obviously, temper that with their age, about what to expect, whether it's going to be a long appointment, a short appointment, whether it's going to be any talk of this or that. And so I think that's important. And finally, just being honest with your siblings. The child's siblings and your other children will know that the family is stressed. They'll feel the family stress, and just communicating with them that, your brother or sister is going to go to an appointment, or they're going to have surgery, and they're going to be gone for a couple of days, and mom and dad, or mom and mom, or dad and dad are going to be stressed, and one of us might be with you, or one of us might not be with you, and just, again, they know what's going on, and they want to feel knowledgeable about what's happening as well. So we have a list of questions. It comes back to the writing down that you can ask your child's doctor, and this is actually on our web page. And these were some of our first time appointments and things like that. And like, how long is it going to take to get an appointment for a diagnosis? We have a policy that any patient with synostosis, we try to get them in within a week. What types of medical and surgical specialists are involved in providing care for cranial synostosis at your center? And again, I'm not trying to promote Nationwide Children's Hospital. I can just tell you what we have. We have a complex team. We have the ACPA standards, we have neurosurgery, we have psychology, but it's a good question to ask. So you know which services you're going to be able to get at that center and what services you might have to seek outside of that center. How does your team assess and address long-term related health issues, such as speech, vision, or psychosocial concerns? And how much imaging we do before and after surgery? Most craniofacial surgeons and neurosurgeons are really.
Did we lose Dr. Pearson?
I think we lost him.
Well, I'll go until he comes
Okay.
back.
Thank you.
It got dark. So what he was saying is most craniofacial surgeons and neurosurgeons will obtain imaging before surgery to, number one, confirm the diagnosis, number two, help guide us during surgery. We don't always obtain imaging after surgery. In fact, with craniosynostosis, we almost never obtain imaging after surgery unless there are concerns and we're looking for something specific. But that would be important to know. Unfortunately,
I do have one question right there that might be helpful. Is there a such thing as too much imaging? Can a doctor over image, or can a center over image? What thresholds should a parent be worried about?
That's an excellent question. Now, with children, radiation is a concern. You don't want too much radiation. If the imaging consists of CT scans and X-rays, that is radiation. Now, MRIs, they don't carry that risk of radiation, but usually, if we're talking about a craniofacial condition, most of the time it's going to be an X-ray or a CAT scan. If the physician or the team has specific things that they are trying to achieve with the imaging, then that's fine. If they're just obtaining imaging just to see what things look like without a specific goal, then it probably could be skipped, So I would ask, if the physician team is saying, let's get imaging, the question is, what are you going to do with this imaging? Is this just to see what things look like, or are we actually gonna do something with the imaging? Are we using the imaging to achieve a specific diagnosis, or to guide a specific surgery? So we try to minimize imaging. Obviously, that varies by patient and by what stage in life they are at. Dr. Pearson lost power at his house.
Oh boy!
He is coming back in a second.
Okay.
So I will. I guess, can you allow me to share, and that way I can share the PowerPoint?
I can.
Thank you. The next question is, what type of imaging are you using, and do you have low radiation? So for example, at our hospital, we can obtain a CT scan. It's called low radiation CT scan that shows us the bones of the skull and the face with less radiation than a regular X-ray. So that would be very advantageous. Dr. Pearson, you're back.
Yeah, sorry, we had a power surge and my power went out and my internet reset. I apologize for that. Thanks, Ibia. Thanks for having the slides.
So we're at the second question on the slide.
Yeah, I heard. So again, what types of treatments do you offer? Whether it be anterior, posterior surgery, mid-face surgery, and how often you perform them, and which ones you perform most often? How do you decide what surgical option is best, and are the parents involved in the decision? And I would say we should actually expand this for older kids. Are the children involved in the decision? How many synostosis surgeries do you do per year? And what types of surgeries, again, and how likely is it my child require a blood transfusion is another fair question, because that's very dependent upon this type of surgery being done, and also the surgical preference and how we have an algorithm that we follow with the anesthesiologist, looking at before we transfuse children, they have to meet certain requirements. Again, what's a typical hospital stay and recovery period for surgery? We feel that this is important. Is your team certified by the American Cleft Palate Association? That is it sets high standards, and it verifies that certain team members will be participating in your child's care over their lifetime. Do you have a board certified pediatric anesthesiologist? And on what age do you usually operate on the baby? And again, this can be expanded to mid-face surgery, other types of surgery, orthognathic surgery. Again, this is just for our younger patients. And just a blank question here, what else would you like to know about the program, treatments? Write them down here. And this is, if you write down this website, you can find this link and download it, so that if you're visiting a different set of providers, it gives you a foundation for that list of questions.
So the second item on our CARE acronym is anxiety management. Now, anytime you're visiting a surgeon, you will have anxiety, and your child will definitely have anxiety. That's just normal. A lot of time, institutions and clinics will have a child life department with volunteers and even professionals who can come, and they're trained to help relieve that anxiety in children. So if the child is, if you're talking about surgery, if the child is having a procedure, the child life specialist can come and really help make the situation better. They can, they distract the child by playing with them, or singing, or listening to music. Anxiolytics means those are medications that we use to decrease anxiety. And that comes into play the day of surgery. So in the preoperative area, obviously it's a very anxious place and an anxious time. The worst time is when your child has to leave you and get wheeled to the operating room. Most children's hospitals, you should have the ability to give the child a little bit of medication that helps them, number one, relax, and number two, forget. And it helps them forget that, that time period when they are away from you and being wheeled to the operating room, which can be very, very anxiety provoking. In terms of anxiety in you, the parent, again, communicating with the doctors, ask them how long is the procedure going to take. Ask for regular updates from the operating room. So most operating rooms should be able to provide you with updates every 1 to 2 hours, so that you know that things are going okay. On clinic days, those can be some of the more boring and anxiety provoking days, because you're often being seen by multiple specialists, and one day you may be getting imaging that day. So it's a long day, and kids get hungry and cranky and tired. So bring some toys with you, bring something to make the day go by easier. And it's always a good idea not to schedule anything important on that day other than your clinic visit. So don't have a place to be after clinic. I can tell you from experience, these visits always go longer than expected. So don't have anything you have to be. On the other hand, you should schedule something fun. So maybe when you're done with the clinic, stop by for ice cream. Do something fun afterwards, almost as a reward, something to look forward to, and something to help you and the child decompress. Be flexible. Those days are long. Like I said, you may be scheduled to be there for 2 or 3 hours, and you might end up being there for 5 hours. The doctor might see things that will require another specialist to see your child. For example, if you bring up that you have concerns about hearing, they may have the ear, nose, and throat doctor come look in your child's ears and then order a hearing test. So a short day can suddenly turn into a much longer day. So just be flexible. Don't schedule anything important, and make sure you schedule something fun at the end.
So one thing I always like to say about just anxiolytics, and just if I can, sometimes when they're given, a child will still cry when they leave you. You have to remember that the anxiolytics cause some retrograde amnesia. So as Dr. 𝐁𝐲𝐬 was saying, they might be upset that they're leaving you, but they haven't had memory of that. And just in terms of the flexibility, I mean, we all have to remember that although the team appointments can be very long, 3-4 hours, if you think about the number of specialists you're seeing in that condensed amount of time, and if you didn't have that team and you went and saw all those specialists in individual appointments, you would be spending far more time than that per week. I mean, I know when I take my children to the doctor, it can be an hour appointment just to see them and get in and get out. And that's just one provider. And if you had to do that 4 or 5 times, it would take a lot more time. So, but I totally agree with Dr. 𝐁𝐬𝐭. We're looking to make sure your child is healthy and safe. And if we see something else, that's the whole point of having the team, is so that we can get other providers who you might not have anticipated seeing that day involved in their care. Thanks, Ibby.
Thank you, Dr. Pearson. Now, you do have a lot of resources, and you should make sure that you use your resources wisely. I will start by saying that the CCA is a great resource that you should use. You should reach out to the CCA if you ever have, if you ever need any advice regarding your child's, where should they go, or what should they do. Now, when it comes to choosing a team for craniofacial condition, like Dr. Pearson mentioned earlier, it would be helpful to make sure that the team is ACPA approved. The ACPA is American Cleft Palate Association, but they don't just deal with cleft palates. They deal with all craniofacial conditions. So any team that you see that is ACPA approved means that that team meets the high standards of the ACPA. You want a team that can provide a comprehensive care for your child and treat your child in a holistic fashion. So you don't want just a surgeon on an island, without help around him. So most of the time, you want a team of specialists from many different specialties that can treat every aspect of your child. It is also important to make sure that your team is a good fit for your child. You need to feel comfortable with the providers on that team. Even if it's the most well-known or team with the best reputation, if you just don't feel a good connection to the providers on that team, then it may not be the team for you. And obviously there are insurance issues when it comes to choosing a team, especially if that team is outside your state. So check with your insurance provider to make sure that if you were to get care at a specific center, that they would cover your child's care. And once you talk to an insurance company and make sure that that's the case, that a lot of the anxiety will go away. I did mention the CCA, and obviously you're watching this right now on social media. So the craniosynostosis and other craniofacial groups can be a very, very valuable resource when it comes to getting advice. Now, it can go both ways. So you do have to be careful, because most of the advice you're getting on social media is not being offered by professionals. The people on social media have not examined your child. So while a lot of the advice can be very useful, you do have to be careful not to take 100% of it as truth or gospel. Anything to add, Dr. Pearson?
I think going back to the social media, it's a good and bad tool, just as Dr. 𝐿𝐬 said. I mean, the problem with anyone's experiences, Dr. 𝐿𝐬 and I can tell you different numbers, what research shows. Research shows that if you have this procedure, the risk of getting an infection is 2 out of 100. But for most people, it's binary, it either happened or it didn't. And so you have to remember that the advice you're getting is from one person's perspective, and it's their N of 1. And so I think it does help release anxiety, because it lets you communicate with people who have similar issues and stuff like that. But at the same time, I think you have to, like Dr. 𝐿𝐬 said, look sometimes at the whole group experience, not just one experience. To talk about empowerment, and this is something we'll both, again, chime in on, I think the first thing is to be a partner with your child, and that has to evolve depending upon the age of your child, and always trying to figure out if something necessary or elective. Dr. 𝐿𝐬 and I, we do a lot of surgery, and the neat thing about what we do is sometimes it just affects function, sometimes it just affects form, but most of the time it affects both. And that distinction about which one of those three it is, function, form, or both, I think is really important. And so explaining to your child, like, this is a necessary surgery, or this is an elective surgery, or this is a mix of those two, is important, because no child is ever going to really want to have surgery. And talking to them at their level is important, but it's different when it's necessary. And that's when sometimes you might have to say to your child, regardless of age, look, you may not want this, but when you're older, or this is what's important. I mean, I always use the appendicitis analogy. When a kid comes in with appendicitis, no one says, not many people say, I don't want my kid's appendix to be taken out, because they realize it's necessary. So that's the one thing I say about partnering, having that explanation of if they're gonna have surgery and they don't want it, why are they having surgery? And then again, talk to them at their level. A younger child isn't going to always, getting deep into the scientific reasons of this isn't going to help a 3-year-old understand why they're going to need why they should have surgery. Whereas if it's a 15-year-old or a 16-year-old, you can logic with them and you can discuss it further with them. So that's why I think you have to realize that a lot of us can get very scientific and just give numbers and this and that. And that doesn't always work for children. So maybe what else would you like to add?
Yeah, it's tricky, because on the one hand, we're telling you to empower your child. On the other hand, again, no child, if given the option, no child would choose to have surgery. So if you empowered every child 100%, then there would be no craniofacial surgery. So how do you reconcile this contradiction? I think information is what you need. So empower your child by providing them the necessary information so that they can hopefully arrive at the correct conclusion. So if they actually need a surgery, they can eventually, at least believe that, it's in their best interest. How do you provide that information? Again, use your providers. Go back to the previous slide. So use the physician team that's taking care of your child. If your child is, kind of apprehensive about surgery, tell your provider. They should be able to talk to your child and you and tell you, okay, these are the advantages of doing this surgery. Your bite will be better. You'll be able to breathe better. Your eyes will be better protected. You'll look better, and just describe it in simple terms to the child. Dr. Pearson and I, we see patients together all the time for mid-face distraction. And they're at that age when obviously nobody wants to have surgery when they're 7 years old. But we talk to their level. So tell them, your bite will be better. You're going to breathe better. You're going to look different in these particular ways, and just tell them exactly. Use your physician team and provider team to help provide your child with information so that they can hopefully arrive at the conclusion that yes, this is for my own benefit, and then they will feel empowered.
And this is again an area where I feel that telehealth has really helped, because you can set up an appointment to talk and allow your child to be heard with the provider outside of the clinical setting. So they're not having the anxiety of I'm at clinic and all this stuff. I think Dr. Kovans and I have had televideo visits with families where, the child just wants to ask us questions, but they're in their home surroundings. They don't feel that pressure of the clinic. And I think that's a great opportunity to connect with your provider, have your provider connect with you, have your provider connect with your child, and really empower them. Next slide. Some other things about teens, because teens are, in my opinion, another special group. As Dr. Kovans said, as kids get older, they don't tend to want surgery, and I don't blame them. But with teens, I think you can kind of discuss long-term goals, and you can talk and say, what, there's a question in the chat room. We'll get to it in a second. Like, what are you going to want when you're 40? That's where having gray hair sometimes helps out. And say, you might not want this now, but what do you think when this option may be gone, you're going to want? And again, I think trust them. We've had, multiple kids as they've matured, when we first talked to them, they don't want surgery at 7 or 8. When we talked to them at 9 or 10, they're a little more into it. And when we talk to them at 11, they're like, they've bought into it, and they realize, as they've matured and stuff like that. And you have to realize a lot of these surgeries, it doesn't have to be a one-time decision. If it's not necessary, if child's not having increased pressure or inability to close their eyes or some other things like that, which are very functional, if it's that quality of life kind of thing, trust them and just keep talking with them. Forcing them to do something when they know it is elective is a big challenge, because all they remember is the discomfort and the dissatisfaction and things like that. And we all have to remember it is their body, and they have to give assent. Not, I mean, you're signing the consent form, but they have to give assent and agree to do it. So I think that that's really important when you're talking with teens. Now we'll go to the questions.
Alicia has a very interesting question. It's the opposite of what we're talking about. So she's asking, what if the child wants to have an invasive procedure that is mostly elective, something like a box osteotomy or facial bipartition? And for those watching, box osteotomy allows us to move the eyes in different directions, and then a facial bipartition specifically addresses wide set eyes, so you can bring the eyes closer together. So she's asking, what if the child wants to have that surgery, but you as the parent don't want them to get it? You don't want to take an unnecessary risk if the surgery is, for the most part, appearance related and not functional. So how do we address that conflict?
That's Dr. 𝐁𝐽𝐬.
I think, and Alicia, you said your child is 4, so still too young to have any of those surgeries. You probably still have 5-6 years, and honestly, you can do them later too. So my answer would be, you gotta get to a point. It's twofold. Number one, you gotta get to a point where both you and your child are in agreement that yes, we're gonna get the surgery, or no, we're not gonna get the surgery. Number two is ask your child why they want to get the surgery. Are they trying, is there something specific that they're trying to fix that's related to their appearance? Obviously, if they want a facial bipartition, that means, their wide set eyes is something that's bothering them. But the third thing I want to say is, it may not just be an appearance related surgery. There may be functional benefits to it. So, we know that a facial bipartition actually involves splitting the palate, and it will improve the bite too. So, and it will also probably help with vision, certain, peripheral vision. So it's not, ask your provider or your physician, is this truly cosmetic, or is there a functional component to it? Now, I agree, a facial bipartition is mostly appearance related, but there are some functional benefits to it. But you have plenty of time. There's no rush. Don't sign up for the surgery until both you and your child are convinced that this is what's needed.
But I want to go back to that too, and like, just this last week in clinic, I ask every child I see, are you being teased or bullied at school? And a child that was 10 said yes, and you should have seen how fast that child's mom's neck did the whiplash and said, you've never told me that before. And then we went and actually had psychology come in and talk with the family too. And so if it's one of those things where they're asking for surgery and you're not comfortable, that goes back to that. Why, going back just as Dr. 𝐁𝐽𝐬 said, why are you interested in this surgery? Let's get to the root of this issue. Is it because you don't like your facial difference and you want to be, have less of a facial difference, or, that, and then like, I'm proud of our psychologists at Children's Hospital. They'll go in and talk to the family and discuss both sides. Why the parents want this, why the kids not, or vice versa. And it just comes back to communication, because they might be harboring thoughts and feelings that they just don't feel comfortable saying to you, or they haven't expressed to you, and things of that nature.
Absolutely. And we have some other questions. So we do have some that were kind of pre-submitted. So this goes back to the compliance question, probably more on the child that didn't want surgery. Do you have any best practice tips and tricks, motivations for if a child is really fighting any kind of compliance, whether it's with orthodontia or just in general fighting the next steps? Do you have any experience that you could offer there?
If that's a real challenge when some preemptive steps have to be done to maximize surgery, and a child isn't willing to do those preemptive steps, it becomes a real challenge. And again, I don't know if there's some magic wand, but just again, it's one of those things where sometimes you have to stop and say, we're going to take a break. We see that a lot in our children with cleft, not a lot, but frequently enough that we discuss it. And they're going to need a bone graft to their alveolus, and they're not willing to brush as regularly they want, and they get orthodontics and they're not compliant as they should be. And we'll just take a break and give the child that power back, and realize that we may have to do it in a year or two, and the timing might not be as ideal, and we can discuss that with the parents and the child. And I think saying in front of the child, we wish we could proceed now, and not being mean about it, just factual. Again, it lets the child know the importance of it. But despite what we want, if a child is going to be totally non-compliant with it, it's going to be a setup for failure in most parts, because they can undo hours of surgery in a quick time if they're not willing to take a little bit of ownership. What do you think, Dr. 𝐶𝐚𝐬?
Yeah, I want to tell that parent who submitted that question, you're not alone. This is very common. I know it probably feels like it's just your child who's doing this, but it's very, very common. A lot of children just don't want to participate. I don't like the word non-compliant, but they just don't want to go through this. So you're not alone. But otherwise, I agree with Dr. Pearson. Ask the provider, is there a time crunch to get this done, or can this wait? The example Dr. Pearson gave is a bone graft for an alveolar cleft. We often have a kind of a deadline. We need to get the orthodontics done and the bone grafting done by a certain age, before the canines start to come out. So that ideally should happen within a certain time frame. But there are things that there's no deadline. So if something can wait, give the child a break.
I really like that answer. That's super reassuring. I know to the parents who are in that struggle, maybe it's good for everyone to have the option to take that break and that step back. So I appreciate that answer. Thank you. So this one, I'm going to try to do my best with it. So there was a lot of people afraid to be that parent, and that could mean anything, whether you're too needy, too many questions, too anxious. So just personally, from both of you, what type of parent motivates you to, obviously you're going to be great to all your patients, but what really motivates you? What style can they try to adopt that gets your attention and puts you at ease, so they can kind of manage how they come off? So a lot of people have this anxiety about how they're coming off to you guys.
Dr. 𝐶𝐚𝐬?
That's a tricky one. Now let me again say, we're not gonna judge you. I know you're worried about being that parent. Well, we know that we're dealing with very, very intense and deep issues. So we're never gonna judge you and say, oh, that she's that parent or he's that parent. That's not gonna happen on our watch. We're gonna take the best care possible of your child, regardless of how you're acting. We know that you're very anxious, and anxiety can manifest itself in many different ways. I bite my nails, but other people may speak in a harsh tone, or anxiety can manifest itself in many ways. So I would just say, just communicate with the provider. That's the most important thing. If you're anxious about something, tell them. Otherwise you're gonna keep it on the inside, and it can turn into something that's pent up. So my answer is, don't worry about being judged, and just communicate as much as possible.
Yeah, I would agree. It's very rare, I think, as providers, that we feel like we have that parent. We're most providers, and again, there's exceptions, are not judgmental. We want to try and meet you. The biggest honor you are doing is allowing us to take care of your child. You are trusting us to take your child and do amazing things for him or her to help them. But we realize, we're not you're trusting us because you come to see us and we're established professionals and things like that. But we have to remember that's what's always in the back of Dr. 𝐁𝐿's and Dr. 𝐁𝐿's in my mind, is that this is an honor to be taking care of your child, and your trust and your faith in us is amazing. So that's the first thing I would say. So in terms of that parent, it's very unusual. I would go back. The most challenging that parent I experience is when they don't want to discuss surgery with their child in the room and don't want it mentioned, because I think it goes back to that. It sets the trap of not being open and honest. And that makes it more challenging, because then you have to kind of sneak around it. And everyone in the, what happens outside is every time, whoever's even the provider or handing the chart to the next person, like, don't mention surgery, because, and I understand it's not always the place, but eventually you can't just bring your child to the hospital and say, oh, by the way, you're having a big surgery today, and surprise them. That's not going to build faith and trust. So I think that's the one thing I would say about trying to not being that parent. And the other thing is again, we're not perfect. We would like to be. I mean, Dr. 𝐁𝐿 is near perfect. I can attest to that. But all joking around aside, I mean, as long as if you tell us you're disappointed, that's okay. As long as you make it's not a personal attack, right? I mean, that would be the only way. And Dr. 𝐁𝐿 talked about a fit. You're going to learn how to interact with your providers and find a team that works for you. But again, we're big boys and girls, and we can handle truth as long as it's not something personal, because we're investing our time and our focus on your child, and we want to help your child. And so it's okay to give us feedback as long as it's not something personal.
Awesome. I really appreciate that. And knowing you, I know you're one of the most personable teams, and you guys really do connect with your patients. So I appreciate that. And that reassurance, again, I think I've said the word reassurance like 5 times now. It is so helpful for parents to hear, because they are carrying around a lot of worry. Like, I want to model good behavior and, sound like I know what I'm talking about. So thank you for being so kind and reiterating that you are not judgmental when they're going through a lot of stress.
Yeah.
Absolutely. So this also kind of piggybacks on that question. Obviously, if surgery is brought up at a team day or at a clinic day, that might be the time you start talking about it. Is there a general recommendation about how much time you prepare communication wise, a month out from surgery, 6 months out from surgery, other than when you might decide at clinic day, oh, in a year or 2 years, we're going to need this?
I think that depends a little bit on the extent of the surgery and the extent of the recovery, and also your child, not only their age, but also how they take things, and so if it's a more minor surgery, say your child wants to have a scar revision, and it's going to be an outpatient procedure, and it's going to be an in and out and not very long. I don't know if as much time and dedication needs to be done to that versus, a big orthodontic surgery where they're going to have a longer term time to recover, or they might have, hardware or distractors and stuff like that. So I think a little bit of that plays into it. I think that the other interplay is some children want to know everything, and they're very planners, and they want to know about that. I know one of my children is like that, and the other one's much more laid back. And so knowing your child and what his or her emotional investment is and how much they need to know. And that's where we have to, as providers, we have to rely upon you, because we have a good feeling for your child, but you know them better about is too much going to be anxiety, because too much information can be anxiety provoking. And for some kids, not enough information can be anxiety provoking. So it's knowing your child a little bit. Dr. 𝐁𝐿?
Yeah, I could not agree more, Dr. Pearson. I think it depends on the extent of the surgery. Now, I am of the school of thought that I like the patient, especially the older patients, to be fully aware of absolutely everything. So I think the jaw surgery or orthodontic surgery example is a great example. They have to know what they're signing up for. It's a rough surgery. I tell them very honestly, it's gonna be really hard to breathe for a week. your jaw's wired shut, your nose is stuffy, it's going to be really hard. And I have them try that. I have them try to breathe with their mouth closed. It's not easy. I tell them, your face is going to feel like a balloon. You're going to be swollen for a while. It's not going to be pleasant. You're going to be on protein shakes. So I want you to go and pick your favorite flavor and stock up on it now. So I'm super honest with them. And I feel the more they know, the more relaxed they get. I'm very honest, and I tell them the worst possible, outcome. And then once they realize, oh, that's as bad as it's gonna be, then they relax. Nobody wants surprises after surgery. The same with the younger kids, the 7 to 10-year-old kids who are having mid-face surgery. Maybe we don't get into as much detail, but we still tell them, look, you're gonna be asleep for a few days after surgery. You're gonna be a little out of it for a while. We tell them slightly more vague terms, but we do try to communicate as much as appropriate for their age. And we start talking about these surgeries a few years ahead of time. So the kids with Apert syndrome, for example, who are gonna need mid-face distraction, we start talking about it when they're 5. Even though they're too young to have it done. So we talk about it a little bit when they're 5, then again at 6, and again at 7. And the first few times they're like, no, I never want to get this done. But then, a couple of years later, they're ready. And so we start talking about these surgeries a few years ahead of time.
And I think, being honest with you, like, a child that's 7 or 8, their worries about, am I going to play on the playground? And am I going to be able to do gym class or have lunch, and things like that they're thinking of. Just being honest with them about some of the limitations that are going to be, just as Dr. 𝐁𝐽𝐬 talks about the orthodontic surgery, when you talk about mid-face surgery, some of the limitations they're going to have is just important to discuss with them. So.
I love that. And I think we've been making, as CCA, we've been making an investment in some of those tips, especially for parents, not just for the preparing the children, but as a parent, if you're a preparer, there are lists. You can buy things. We've listed that out for some of the big surgeries, like things to have on hand, things to pack. And if that is something that motivates you, we can certainly show you some resources we've developed over time where you can check off your lists. And if your child is a preparer, like Dr. 𝐁𝐽𝐬 said, involve them in picking out their protein shake, have a taste test day. So I think there are ways to prepare. And that really works for me too. Feeling like I'm in control of some part of it. I've said it before on webinars, but even just drinking a lot of water in the days leading up to it. Oh, I know there's going to be easier if I have a blood draw, if my veins are hydrated. So just little things. Again, it's probably works better for those type A over preparers, but those are things that we've seen mentioned that work. Another question that I have, and I'm pulling some of these from other support groups we've had. So this one came earlier this week, and it is a follow-up. So this person has a small infection, and they were asking the question, there's a potential for this to be done outpatient, and then there's a potential for me to have to go back more of an inpatient with general anesthesia. And if they're really adamant about wanting it outpatient because they don't want to go back to the hospital, what questions should they ask? And then I guess maybe my sidebar is, when your doctor is recommending you go back in for a more inpatient style service, what is the rationale behind that? That was a big question. Why are they wanting me to go back in?
Dr. 𝐁𝐽𝐬, go ahead.
Yeah, I will start by saying that you should do whatever your doctor is saying. So we don't know the specific situation here, but if your doctor is recommending that you go for an inpatient stay, then that's probably the best thing. In the specific case of an infection after surgery, I'm not sure if they're recommending actual going back to the operating room, but if they're going back to the operating room, usually if there's an infection, we get cultures in the operating room, and then you keep the patient on intravenous antibiotics, broad spectrum that cover everything for a few days until the culture results come back. And then you have to consult the infectious disease service So there's a lot of moving parts that are a lot more efficiently and easily done if you're an inpatient than outpatient. And you have to see multiple specialists, to try to make sure the infection is controlled and that you are on the correct antibiotics. But I would always do what your doctor is recommending.
Yeah, and I want to echo that. We understand that telling someone they're coming in the hospital when they're not expecting to is stressful and anxiety-ridden decision, and we don't take it lightly. It's not like we're like, oh, let's admit as many people to the hospital as we can. We're doing it because we think it's in your child's best interest, whether it be for antibiotics, like Dr. 𝐁𝐽𝐬 talked about, or if you're trying to think, well, could this little thing be done in the office? Sometimes you can't get things as numb as you can in the operating room. There's that limitation, there's lights limitation, there's equipment limitation, or we think that we might have to get another test after the intervention. As Dr. 𝐁𝐽𝐬 said, it's easier to do that inpatient. Physicians realize that having a family, especially if they're not thinking they're going to be admitted, it's stressful. It's stressful for us too, and I know as providers, Dr. 𝐁𝐽𝐬, Dr. Chapot and I, we don't make that recommendation lightly, because we realize it's a shift in what you were expecting and things of that nature. But that's where you have to have a little bit of faith in your provider, that they are thinking of your child's best interest, and they're using some of, it comes back to that N of one versus kind of grander experience, and you have to rely upon their grand experience. And they say, I've had this problem before, I've heard about this problem before, and the road I'm choosing, it might not be the easiest path, but it's the best path. And have that faith in your provider that they're still thinking about your child's health first. And then once they put that in their mind, then they're deciding the best care after that.
I'll add that almost all physicians I've ever met are heartbroken when their patient develops an infection after surgery, or if their patient has to go back to the operating room after surgery, or if the patient has to get admitted after surgery. It's a heartbreaking thing, because we feel like we've disappointed you, but these things happen. We don't have full control over these things. So when the physician's actually recommending that we go back into the hospital, they're heartbroken, but they're doing it for an actual reason.
I appreciate that answer. And it's not so much a question, it's just a statement that really beautifully captures this last question. I think it's great to see both of you as humans, and as more than just, the doctor at the hospital or the surgeon at the hospital. And so the last comment was like suggesting that it really helps to see providers outside of the hospital setting. And I didn't know if you had any comments. I know CCA tries to facilitate that with picnics. I know you guys are a very high touch team. So if there's any comments on seeing your provider outside of the hospital setting, I would open it up for that.
Well, we're fortunate in the fact that we have some families who are socioeconomically able to help us with different events. We've had a movie gathering where a family has rented out a couple movie theaters, and we invite their families, and that's wonderful. It's great to have my kids and my wife come and be part of that and see a movie with people and with the families, and that camaraderie, and just encourage your team to do things. We have a Valentine's Day party every 2 years where we collect shoe boxes and things of that nature. We had different picnics, and it's wonderful for the physicians too, because it lets us interact with families outside of the constraints of you're coming and when we interact outside, it's a non-clinical encounter. There's no stress, there's no anxiety. Your child, and that you're not coming to talk about something medical. You're coming to go walk around the zoo together, or something that's enjoyable for everyone. So we love it too. That's all I would say, is try to encourage your team to develop it. It's tough because it sometimes involves resources, it involves time, but it's always been well worth it.
I never leave the hospital, so it's no. In all seriousness, it is wonderful to see at events. Greg and I just saw a girl that we did the 4-3 on. A few years ago, we saw her at an event, and it was so beautiful because she was wearing this beautiful dress and had these flowers in her hair, and it's just so wonderful to see her happy and smiling and just thriving.
Yeah, it's wonderful.
Awesome. Awesome. Well, I could talk all night to you too. And Annie, we're missing her, Dr. 𝐁𝐿𝐴, but I really do appreciate the time. I want to reiterate to all of our listeners now and in the future that the team at Nationwide Children's, they volunteered their time. So thank you from the bottom of our hearts for presenting this information and sharing from your experience again. We very, very much appreciate our medical providers doing this outside of the hospital setting. It means a lot. We believe in that at CCA. And we also want to reiterate to the parents out there, if you are wanting support during surgery, whether it's a phone call, a text message, or a care package for your child, you can sign up for that on our website. We know that that's not a lot, but sometimes that's exactly what you need to just take you out of a very stressful moment and get a text from somebody who knows what it's like and has been there. So we can hook you up with some people that will support you during your stressful days. So those resources are there. And definitely in the Facebook comments and in the YouTube video, we will link to your center, and we will link to that resource that you shared with the questions. I think those are so helpful. No matter what team you're with, you want to be able to ask the right questions and feel that team fit. So I really, really appreciate the time. Thank you so much.
Thank you. Thank you so much for having us. And thank you and the CCA staff for all you guys do for these families. I mean, you're an amazing resource, amazing positivity in people's lives, and offering the support and all you do. It's a wonderful blessing, and thank you so much.
Thank you, Erica, Annie, and Kara. Thank you to the CCA for having us, and thank you for being a community for children with craniofacial differences. It's important to look up and see that you're not alone, and there's a big community there supporting you, and that just makes all the difference. So thank you to the CCA.
Absolutely. It is our pleasure. Well, when we end it, it turns off on Facebook, it turns off the recording. So when I want to just thank you once again and tell everybody out there, if you have questions for Dr. 𝐁𝐿𝐴, Dr. Pearson, or Dr. 𝐁𝐿𝐴, who helped with this, there is a link that you'll be able to click to contact them for more information. And you can always reach out to ccakids.org to get in touch with us. So have a good night, everyone. And
have a safe night.
Stays on.
Thanks. Thank you. Have a safe night. Thank you.